It's nice to meet you. My name is Doslin. I'm going to be the nurse practitioner doing your head to toe assessment today.
Okay.
Okay. So can we first start? Can you just tell me your name, your age, and occupation?
My name is Tamron Smith, and I'm a social worker.
Okay. And then can you tell me the date, including the month, the day, and the year?
Today is December 6th, 2023.
Okay. And can you tell me what city we're in
This is Youngstown, Ohio,
and the reason for visiting today?
um, for a checkup.
Okay, sounds good. So I can tell that you're alert and oriented to person, place, and time and the situation. So now that we've established your mental orientation, do you have any questions before we begin this exam?
No.
Okay. So I do see that you're dressed appropriately for the occasion. Your mood seems appropriate for the situation. Your posture's good and your dress is good as well.
Thank you.
Okay. So next we're gonna move on to the skin assessment. So I'm just gonna come over here and grab my pen light. Okay. So I'm just looking at your skin and it is appropriate for ethnicity, even in brown throughout your skin. I'm just gonna look at the skin on your back and it is even as well. And on your front, just take a peek here. And it is even and normal. Um, Your skin is warm, dry, and intact. I don't feel any lesions or anything like that. Do you have any pain right now?
No.
Okay. So that's good. I'm just gonna check your skin temperature up above your clavicle, and that was less than 3 seconds. There was no tinting noted there. So I'll continue to inspect different areas of your skin as I go. But just for now, your skin doesn't look like it has any issues or concern right now.
Okay.
So I'm just gonna look at your nails, and they look nice and clean, well groomed, intact. Nail beds are pink. I don't notice any broken nails or any deformities. I don't notice any abnormal ridging. Cap refill is less than 3 seconds on both sides. Same with the toes, less than 3 seconds, well groomed. Um, I'm gonna look at your. Can you put your nails together like this for me? And just line them right up against each other. No clubbing noted there on any of those fingers. You can put your hands down. Thank you. Hair color is a dark brown to black in color. It's evenly distributed throughout. It doesn't look dry or brittle. The length is appropriate. The texture is normal and even throughout. Same with the eyebrows. Same with the eyelashes. They're even throughout. I'm just looking at the scalp here. I'm just going to have some light. And the scalp doesn't appear to have any masses or lesions or dry spots. No discoloration noted there. So that's good. So next I'm just gonna look at your face. Facial features appear symmetric bilaterally. Eyes are in the normal place on the face. Skull is symmetric and no abnormal shape or deformity. No bulges or lesions or nodules noted. I don't feel any nodules or anything like that. Um, Next, I'm going to look at your neck. So it appears even. I do see the hyoid bone here. I don't know any protrusions of the thyroid. Can you turn side to side for me? Thank you. No protrusions noted. Look up for me. Look down. Tilt your ear to your shoulder. Other side. Neck range of motion is appropriate. So I am just going to feel down underneath your thyroid bone. Thyroid feels normal, no abnormalities noted. Turn to the side for me. No abnormalities noted. Swallow for me. Okay. Was there any pain with that?
No.
Okay. Sounds good. All right. So yes, no tenderness noted. No abnormalities with swallowing. Next, I'm just going to assess your lymph nodes. So we are going to start. I'm going to do it this way so we can see with the camera. Preauricular, postauricular, submental, submandibular, anterior cervical, posterior cervical, and then turn to the side for me. Deep cervical, other side. Deep cervical on this side. And then you can turn straight. Supraclavicular, infraclavicular, and occipital. And there's no abnormalities noted there. The lymph nodes feel appropriate in size and shape. No enlargement or irregular borders noted. Okay, and then I'm just going to auscultate some areas and listen for bruits, okay?
Okay.
So I'm going to listen temporal, temporal, I'm going to have you close your eye. Listening over the eyes. Okay, and then we're going to listen thyroid. Okay, and I don't hear any bruits, so that is good. Next, I'm going to feel your temporal mandibular joint. So I'm just going to feel here. And will you open for me? Okay, I don't feel any crepitus. And then go ahead and close again and open. Don't let me close your mouth. Okay. All right, that feels normal. And you have a nice strong jaw. Next, we're going to move on to inspection and palpation of your eyes. We already talked about your eyebrows and your eyelashes. We talked about the symmetry and shape and location of your eyes on your face. So I am just going to have you close your eyes. Okay, open them. All right, there's no fasciculations or tremors or flakiness, redness or swelling noted to your eye area. No discharge or foreign bodies noted bilaterally. Eye color is brown, and pupil size is a 6 bilaterally. No pupillary defects or nystagmus noted. The lacrimal glands appear intact. Any pain?
No.
Any pain?
No.
Okay. And extraocular eye muscles are intact. Okay. Okay, next we're going to do your ophthalmic exam. So I'm just looking at your eyes right now, and your lenses look very clear. I'm just going to use a little light to show that they look about the same. All right, and then I'm going to come in and I'm going to first look for your red reflex, okay? So I'm just going to place my hand above your eyebrow here. And I do see your red reflex, and it's pinkish in color. So I'm going to come in a little closer here. I see your optic disc, which is yellow in color. Look right at me. Macula is normal. I'm going to come over on the other side and do the same thing. Okay, so just look straight ahead for me again. Placing my hand above your eyebrow. Okay, red reflex is pinkish in color. Viscous yellowish in color. Vascular to that eye is normal bilaterally. Look right at me. Macula is normal. And the anterior chamber is deep. All right, next I'm just going to assess your ears. So I'm just inspecting right now that your auricles and mastoid area appear normal. If you're just looking at them. And then I'm just going to palpate. Any pain?
No.
Okay.
No.
Go to this other side. Any pain?
No.
Any pain?
No.
Okay. And so your ears are symmetric bilaterally. I don't know any lesions or deformities, abnormal masses or lesions. The skin is dry and intact and has appropriate hygiene. So I'm just going to grab my otoscope and I'm just going to look at your auditory canal. So I'm going to pull your pinna up and back and have you tilt your head to the side for me. Turn your head a little more forward. I'm just coming in. Let me know if I'm hurting you, okay? Auditory canal. No lesions or masses noted. Slight seroma noted in the canal. Tympanic membrane is nice and pearly white. No lesions, no protrusions, no lacerations noted. I'm gonna come over on the other side here and do this ear. Do the same thing for me, just tilt a little to the side. Pull your pinna up and back. Let me know if I'm hurting you. Right. Auditory canal appears normal over here as well. Slight seroma noted in the canal. Nice and pink. No lacerations, protrusions, perforations. Tympanic membrane nice and pearly white. No abnormalities noted on this side either. Okay, so next we're going to move on to our nasal assessment. So I am just going to feel here. Any pain?
No.
No lesions, masses noted. I'm just going to have you look up. Tilt your head back. And I'm just looking in your nasal canal. Pink. No abnormalities noted. No protrusions, lesions, swelling. Bilaterally. Okay. All right. So, next I'm just going to do some hearing tests with you, okay? So I'm just going to have you cover up one ear. I'm going to whisper a word, and I want you to tell me what it is, okay?
Okay. Pink.
Okay, cover the other ear.
Apple.
All right, wonderful job there. Next test that I'm going to do is called the Weber test. So I'm just going to hit my tuning fork. I'm going to put it in the middle of your forehead. I want you to tell me whether you can hear it in one ear and which ear, whether it's left or right, both ears, or neither ear, okay?
Okay. I can hear it both.
Okay, good.
It stopped.
So that is just testing whether or not there is a balance in between your neurological function of your ears, okay?
Okay.
The next test I'm going to do is called the Rene test. I'm going to hit my fork, place it on your mastoid bone behind your ear. I want you to tell me when you stop hearing the vibration. I'm going to then move it in front of your ear, and I want you to tell me again when you stop hearing the vibration, okay?
Okay. I stop hearing it. I stop hearing it.
Okay, do the other side.
I stop hearing it. I stop hearing it.
Okay. And sound conduction should be twice as long as bone conduction. And so your tests were normal there. Next, I'm just going to palpate your frontal and maxillary sinuses, okay? So I'm just coming in above your eye, underneath your eyebrow, right in here. Any pain?
No.
Okay. And then your mastoid sinuses, any pain?
No.
And then I'm just going to tap here. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay. All right. So yeah, no tenderness or swelling noted to your sinuses there. So next I am going to assess your mouth and throat. So I'm just looking at your lips and they appear normal in size and shape and color for ethnicity. I don't note any cracks or dry skin. Go ahead and open your mouth for me. Buccal mucosa is pink. No abnormalities noted. No lesions or protrusions. Palate is normal. Go ahead and stick your tongue way out for me. Say ah. Uvula is normal in shape. It's pink. Tonsils are about a 1+. Tongue is midline when sticking it out. I don't see any lesions or protrusions. It's normal in color and shape. Okay. Can you just show me your teeth? All right. Teeth appear normal in shape and size. Do you have any pain? Okay. Color is appropriate. No signs of infection or swelling in the mouth and throat. No ulcerations noted either. So next we are going to move on to your chest assessment. So I'm going to note some landmarks here. Your trachea, which is midline. Your suprasternal notch and the angle of Louis, all midline. Okay, so I'm just looking at your chest. It appears symmetric. Chest expansion is symmetrical anteriorly, posteriorly as well. I don't notice any difficulty in breathing. Rate is even at 16. Rhythm is regular. No tachypnea or dyspnea noted. No abnormal audible lung sounds, which would be crackles, rails, wheezes, rhonchi, stridor, or friction rub. Anterior, posterior versus lateral diameter is appropriate. Lateral diameter is 2, anterior, posterior is 1, which is appropriate. 1-to-1 would indicate obstructive disorders of the lungs like COPD or emphysema. So I'm just going to palpate in the front and in the back, and I just want you to let me know if you have any pain, okay? Any pain?
No.
Any pain?
No.
Put your arm up on this side. Pain?
No.
Pain?
No.
Okay. In the back here? Any pain?
No.
Pain?
No.
Pain?
No.
Pain?
No.
Okay. No abnormal lesions, protrusions noted. I don't feel any crepitus, which would indicate air trapping underneath your subcutaneous layer of tissue. The next thing that I'm going to check is your tactile fremitus. And it would let us know if it's increased, it would indicate consolidation like pneumonia. If it were decreased, it would indicate obstruction, which would be like COPD or emphysema. Okay. So I'm just going to place the palm of my hand on your chest. I'm going to do the same thing, front, back, and on the sides. Each time I place my hand down, I want you to say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
Around to the back.
99, 99, 99, 99, 99, 99.
Okay, and the vibrations were appropriate. So next, I'm going to check your thoracic expansion. So I'm coming down to about your 10th rib here. I'm going to place my thumbs together in the middle of your spine. I'm going to have you take a deep breath and release. Okay. All right, and chest expansion is symmetrical. And I am going to come back around to the front, and I am going to percuss the front of your lungs. Let me know if you have any pain, okay? And we're looking for the sound of resonance. Any pain with those?
No.
Mm-hmm. Now in the back, what I'm going to have you do is I'm going to have you exhale all of your air out. I'm going to percuss down, and I'm going to make a mark. When I make that mark, you can go ahead and breathe, okay? But until then, I want you to exhale and leave all that air out, okay? Okay, go ahead and breathe. Ready? I need you to do it one more time. Okay, exhale completely. Hold your breath. Okay, go ahead and breathe. Okay, now this time, I want you to take a deep breath and hold it, okay?
Okay.
Okay, go ahead and breathe. All right, we're gonna check that, and normal finding would be for it to be at least 3 centimeters. Yours is about 5 centimeters on the left, 5.5 centimeters on the right. So that's good. So next I'm just going to auscultate your lungs. So each time I place my stethoscope down, I want you to say blue moon, okay? And what this is going to test is your vocal resonance. And if it should be clear at the top and more muffled as we go down, okay?
Okay.
So just say blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay.
Blue moon. 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 Blue moon.
Okay. The other two tests we could have done were the egophony test, where I would have you say the letter E. If you said the letter A, it would indicate consolidation. And then the whisper test, where I would have you whisper, and if I hear anything at all, then that would also indicate consolidation. Okay? Okay. So now I'm just looking at your chest wall for symmetry. Just sit up straight for me, arms at your sides. Chest appears symmetric. I don't see any heaves or lifts. I'm just going to note some anatomic landmarks. And so we have our apex here, the base here, sternum, right sternal border, and left sternal border. So I'm just going to have you lie down really quickly. And I'm just going to use some tangential lighting. And I don't see any heaves or lifts there. So while you're still laying down, I'm going to use the upper portion of my palm, and I'm going to feel for a thrill. So I'm gonna feel an aortic, which is the right sternal border, second intercostal space. All right, and then second intercostal space, left sternal border is the pulmonic, the Erb's point, which is the third intercostal space, left sternal border, tricuspid valve, which is the fourth intercostal space, left sternal border, and the mitral valve, which is the fifth intercostal space, midclavicular line. And I don't feel any thrills, or I don't feel any heaves. And then I'm just going to assess for thrills at the base, left sternal border, and apex. And I don't feel any of those there. Next, I'm going to listen in all the same areas. I'm listening for rate, rhythm, intensity. Aortic. Pulmonic. And I'm listening with my diaphragm. Erb's point. Tricuspid. Mitral. I'm going to come back through and I'm going to listen with my bell to see if we hear any murmurs. Mitral. Okay. No abnormalities noted with that. Rate and rhythm was even. No tachycardia noted. All right, and then I'm just going to have you sit up. I'm going to listen to in all the same places. Okay? Okay, listening first with my diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. Coming back in with my bell, aortic, pulmonic, Erb's, tricuspid, mitral. No abnormalities or murmurs noted. I'm going to have you lean forward for me and hold your breath. It brings the base of the chest closer to the heart, and I'm going to listen with my diaphragm for any murmurs. And then I'm actually going to have you lay back down real quick and turn over to your left side. And I'm going to palpate your mitral valve from this point And I'm also going to auscultate from this point as well. Okay, no abnormalities noted. If we were to find a murmur, we would want to grade that murmur between 1 and 4, increasing in intensity as we go up in number. We would note the intensity, the pattern, the quality, the location, whether it radiates anywhere, and if there's any variation with the respiratory phase. So when I had you hold your breath, and then when I assessed it while breathing, so we would note whether or not either of those would affect it. Okay, so next we're going to assess your abdomen. So I am just looking at your abdomen while you're laying supine, and I note that the shape of your abdomen is normal, symmetric, no abnormalities noted. There is hair scattered throughout the abdomen, no striae noted. Skin appears intact, color is appropriate for ethnicity. I don't see any abnormal venous return patterns just upon inspection. Next, I'm going to listen for bowel sounds in each of your quadrants. So, right lower, right upper, left upper, left lower. Okay, bowel sounds are active in all 4 quadrants. Next, I'm going to listen for the arteries in your abdomen. So we're going to start with the aortic, which is just below the costal margin here. Renal, which are just below those. Iliac, which is 45 degrees from the umbilicus. And femoral, which is just inside the groin here. I'm going to do the same thing with my bell. Listening for any bruits. Aortic, renal, iliac, and femoral. Okay. And no bruits noted, no abnormalities noted there. All right, so the next thing that we're going to do is I am going to measure your liver span. So I'm going to percuss down on the right side about your nipple line. I'm going to percuss down until I feel from the resonance I feel from your lungs down to your liver. Okay. And then I am going to go up from your umbilicus. Okay. And we are going to measure that. Okay. And that was 8 centimeters, which is normal. So right under your left diaphragm, I'm going to percuss down, and I'm just going to feel it go from resonance to tympany, and that's going to know where your gastric air bubble is located. Okay. All right. And that's about between the 8th and 11th rib, mid-axillary line. And we did feel the gastric air bubble. And I'm just going to percuss again, just to make sure we don't feel any dullness. Dullness would indicate that the spleen is increased in size. Next, I'm just going to palpate your abdomen. We're doing light palpation first, and I just want you to let me know if you have any pain. Making sure to check around the umbilicus, the umbilical ring. Any pain?
No.
Okay. And there are no lesions, masses, lumps, or deformities noted there. Next, I'm going to check a little deeper and tell me if you have any pain.
No. No.
Okay. Any pain with that?
No.
No lumps or abnormalities noted, and no hernias noted around the umbilical ring. Next, I am going to feel around your 11th or 12th rib, right below the costal margin here. And I'm going to see if I can feel your liver. Take a deep breath for me. And this just displaces the liver down so that maybe we can feel it. And I do actually feel the liver margin there. Any pain with that?
In my back.
Oh. Okay. Well, we can assess that when you sit up. Okay, next we're going to check your Murphy sign. So I'm going to place my hand under your liver border here, okay? And I want you to take a deep breath. Exhale. Any pain with that?
No.
Okay, so your Murphy sign is negative. If it was positive, that would indicate gallbladder inflammation. So I'm going to come on the other side of you, and I'm going to stay on the same side of you. I'm going to pull this hand around, okay? I'm going to place my hand here. Take a deep breath for me. Okay. No splenomegaly noted. Okay, next I'm going to check for your aortic pulsations. So I'm just going to feel down here to the left a little bit. I'm just looking to feel the pulsations. And I do feel them. And it is about 3 centimeters, which is normal. 2.5 to 4 centimeters is normal. Next, I'm going to check your McBurney's point, which is in the right iliac spinal area. I'm going to go a third of the way down from the umbilicus, and I'm going to press down. Any pain with that?
No.
One more time. Any pain with that?
No.
Okay. And if there was any pain with that, that would be a positive McBurney sign, which would note issues or abnormalities, maybe some inflammation of your appendix. So next I'm just gonna come over here and grab my reflex hammer. And I am going to check your abdominal reflexes, okay?
Okay.
So I am just going to drag my reflex hammer towards your umbilicus. And a normal reaction is for your muscles in that area to contract. If they don't, it can note spinal abnormalities. Okay, and I did see that contraction in each of the areas that I checked. Next, I'm just going to have you sit up. And I'm going to check your kidneys, okay?
Okay.
So I'm going to come around on this side. I want you to tell me if you have any pain. Any pain?
No.
Come around to the other side. Tell me if you have any pain. Any pain?
No.
Next, I'm just going to see if I can palpate. Sit up straight for me. Arms down at your sides. Okay, don't feel anything on that side. Don't feel anything on that side. Did you have any pain with that?
No.
Okay, next I am just going to palpate some arteries, okay? So we're going to assess the carotid. 2 plus. 2 plus. Brachial. 2 plus. 2 plus. Radial. 2 plus. 2 plus. Popliteal, which is behind the knee. 2 plus. And 2 plus. Posterior tibial, which is right behind the inner aspect of the ankle. 2 plus. And dorsalis pedis, which is on top of the foot. 2 plus. And 2 plus. Okay, next I'm just going to check your jugular venous pressure. So I'm just going to have you lay back for me, please. Okay. And have you turn your head to the side. And I'm just using that tangential lighting to see if I see any abnormal jugular heaves. Okay, and turn to the other side. Okay, that looks normal. And then I'm just going to measure. It's about 5 centimeters. Turn the other way for me. And that one is about 5.5 centimeters, which is normal. We want that to be less than 9 centimeters. Okay, now we are going to assess your cranial nerves, okay? So the first cranial nerve that we're going to assess is your olfactory, which is the first cranial nerve that is responsible for your sense of smell. So I just want to have you close your eyes and occlude one nostril. So plug one nostril for me. And I want you to tell me what you smell.
Alcohol.
Okay. And then keep your eyes closed. And go ahead and occlude the other nostril. And tell me what you smell.
Cinnamon.
Yes. Okay. Next we are going to assess your optic nerve, which is your second cranial nerve. So I'm going to stand about 10 feet back from you, and I want you to cover up one eye. And I want you to read the lowest line you see for me.
E D F C Z P.
Okay, cover the other eye and do the same thing.
F E C F D.
Okay, good. Next, I am just going to stand in front of you. I'm going to have you cover one eye. Actually, turn toward me. I'm sorry. I'm going to have you cover one eye. I'm going to cover the opposite eye. And I want you to tell me when you see my fingers what number I'm holding up, okay? And just look straight at me.
2. 3. 3.
Okay, switch.
1, 2, 3.
Okay. Good there. Next we are going to check your oculomotor, trochlear, and abducens nerves. Okay? We're going to check all of those together. So I just want you to look at my pen light, and I just want you to follow it with just your eyes, okay? Don't move your head. Okay, good. And then I am going to just dim the lights here real quick. And I just want you to look straight ahead. And I'm just checking to see if your pupils constrict. And I'm looking to see if both pupils constrict together. And they do. And then I just want to have you look right at my pen light. And I want you to follow it in. And your eyes do go in and your pupils constrict, which is the response we want to see. Okay? All right, so I just want to have you bite down because the next cranial nerve that we're checking is going to be your trigeminal nerve. So I just want to have you bite down against resistance. Open. Okay. Open. All right. Good there. And then I'm going to touch you with either a dull or sharp object, and I want you to tell me whether it's sharp or dull, okay?
Okay.
It's a Q-tip, so it'll just feel like a soft brush, and I want you, that's dull, and then sharp, okay?
Soft.
Dull.
Dull.
Close your eyes, I'm sorry.
Dull. Sharp. Sharp. Soft. Dull. Dull. Sharp.
Okay. We already tested your acoustic nerve when we checked your ears earlier. So we also checked your glossopharyngeal earlier when I had you open your mouth and say "ah." Your uvula lifted. Now would be a time that we would normally do a gag reflex, but we're not going to do that today. Your vagus nerve is intact. I don't hear any hoarseness or abnormal word sounds. You swallow, and do you have any pain when you swallow?
No.
Can you swallow for me now?
Okay.
Okay. Any pain with that?
No.
Okay. Next, we're going to check your spinal accessory nerve. So I'm just going to have you turn your head against my resistance. Other way. Shrug your shoulders. Okay. Looks good there. And then stick your tongue out. Move it from one side to the other. Up and down. All right. And that was assessing your hypoglossal, which is the 12th cranial nerve. Okay, next we're going to do some tests and we're going to assess your cerebellar function. So we're just evaluating your coordination as well as fine motor skills. So the first test I'm going to have you do is place your hands on your lap for me. And then I just want you to flip them over as fast as you can. Okay, and then you can stop. Thank you. And then I want you to touch your finger to your nose and then touch my finger. Keep doing that. Okay, other side. Okay, good. I'm going to have you stand up. And I just want you to walk that way and come back. Turn around and come back. Okay, turn around and come back. Next, I'm going to have you walk in tandem. So you're going to touch your heel to your toe. And I want you to go across and come back. Okay, and you can sit back down, please. Next, I want you to take the heel of your foot and drag it down your opposite knee, drag it down your shin. And then do that on the other side. Okay. All right, and those are all of our tests for cerebellar function. Next, we are going to test your proprioception, which just kind of tells us if you are able to sense your body in space, okay? So I'm going to have you stand up, face me, feet about shoulder width apart. I want you to cross your arms across your chest, and I just want you to stand there for 30 seconds. Okay, and I want you to close your eyes. Stay standing the same way. Okay, you can have a seat. And there was no swaying noted there. So that was a negative Romberg test. I'm going to have you close your eyes again. I'm going to do the same test that we did before. I have a dull object and a sharp object. I want you to tell me if what I touched you with was sharp or dull. And then I want you to tell me where I touched you, okay? And just put your hands on your lap for me, please. Okay.
Dull on my arm.
Which arm?
Left.
Okay.
Sharp on my right hand. Dull on my left leg. Sharp on my right leg. Sharp on my right foot. Dull on my left foot.
Okay. All right. And then I am going to have you keep your eyes closed and open both your hands. I'm going to hand you two objects. I want you to tell me what they are, okay? Just use that one hand and tell me what that is.
This is a battery.
Okay, that is correct.
This is a paperclip.
Okay, that is correct. Next we're going to do our 2-point discrimination. So, I am going to grab my two soft objects, okay? And I'm going to have you close your eyes, and I just want you to tell me whether you feel me touching you with one or two, okay?
Okay. One. Two. One. Two. One.
Okay, good. All right, next I'm going to do the graphesthesia test. So I'm going to have you open your hand. I'm going to draw a number. Close your eyes. I'm going to draw a number in your hand, and I want you to tell me what number it is.
3. 1.
Good. Okay. And then next, I'm just going to have you close your eyes again. Place your hands out. I want you to tell me whether I move your digit up or down, okay?
Okay. Up. Down. Up. Down.
Okay, good. Okay, next we're going to do some deep tendon reflexes, okay? So we are going to start with the brachial. I just need you to relax your arm. Relax your arm in my hand. Okay. Check this out. Right. We're going to check the brachioradialis. All right. Okay. And then we're going to check the tricep. Let your arm go in my hand. Okay. All right. And then popliteal. Okay. This side. All right. And then we are just going to check Achilles. All right, and while I'm down here, I'm going to check a Babinski reflex. I'm just going to take a sharp object and run it up your foot. A normal reaction is to either curl your toes up or stay straight. A positive Babinski would be if you fan your toes out, and that is an abnormal finding. We only see that in babies. Okay, and then next I'm going to check for clonus. So I'm going to dorsiflex and plantar flex. Just let your foot go on my hand, let your ankle go. And I'm just going to dorsiflex and plantar flex your foot a few times. Let go. No clonus noted. You do this foot too. No clonus noted. Okay. Okay. I'm just going to look at your hands and wrists again. I'm just going to palpate. I don't feel any abnormalities, no lumps, no deformities in your hands or wrists. We're going to go through some range of motion, okay? I want you to spread your fingers out, bring them back together. I want you to lift your hands up, down, turn your wrists out, in, bring them in like this, okay? Next, we are going to move on to your shoulder. So we're just going to look for any swelling or redness, any abnormalities, okay? All right, so to test your shoulder range of motion, I'm just going to have you lift your arm up and down and bring it back behind you. Okay, same thing on the other side. Lift your arm up, bring it down. Bring your arms out like you're going to tee off. Okay, looks good there. Did you have any pain with that?
No.
All right. And then I just want you to bring your arms across your body like this. Okay, any pain with that?
No.
Okay. We have tests that we would do if you were to have any kind of discomfort with your shoulder. We could do a Speeds test, a Neers test, Hawkins test, an apprehension test. But since you don't have any pain or anything, we're not going to do those right now. We already checked the range of motion in your neck when we looked at your thyroid, so we won't do that again. So I'm just going to have you stand up for me. And next, I'm just going to inspect your spine. So I'm looking at the curvature, and I see that your cervical area of your spine is slightly concave, and thoracic spine is convex, and then lumbar spine is slightly concave again, which is normal. I'm going to have you turn to the side for me, and I'm just going to palpate down from your C7, and I'm just feeling for any bulges or deformities in your vertebrae, which I don't feel any. All right. Okay, so can you bend over for me and touch your toes if you can? I'm looking for scoliosis. I don't see any abnormalities. I don't see any I don't see any discrepancies in limb length. The hips are even, shoulders are even. Go ahead and you can stand back up for me. And I just need you to laterally bend to the sides. And we're just checking your hips with that. And bend forward and backward. Okay. Next, I'm just going to have you lay down Lay down. And I just want to have you lift your leg all the way up as far as you can. Okay, bring it down. Other leg, bring it up, bring it down. Any pain with that?
No.
Okay, I'm just going to lift your leg here, and I'm just going to check for any kind of ACL injury. Any pain with that?
No.
Lift this leg. Any pain with that?
No.
All right. I'm going to have you stand up again and bend your knees. Okay, any pain with that?
No.
All right, you can stand up. Do you have any back pain or anything like that?
No.
Okay, I'm just going to have you sit again. And I'm just going to palpate. And I'm going to feel the epicondyles of your femur, the condyles of your tibia and fibula. I feel your patella. It doesn't feel like it displaces in any way. No bulges noted. I'm going to check the same thing on this other leg. Any pain with that?
No.
Knee doesn't displace, so that's good. If you were to have any kind of pain with any of that range of motion, we could do the anterior posterior drawer sign. We could do the varus and valgus test. That would be looking for any meniscal injury. Those drawer signs look for ACL injury. We could do a Lockman's test. Next, we're going to look at the feet. We already noted the color. And next, we're just going to do the range of motion. So I just want you to roll your foot in a circle for me. And that checks all the range of motion in the ankle. And that is appropriate. And just bend your toes up, down, spread them out, bring them back together. Do the same thing on the other foot. Roll your ankle in a circle, flex it up, flex it down, spread your toes out, bring them back together. Okay. Any pain with any of that?
No.
Okay, thank you. Do you have any questions?
No.
All right, well, that concludes our assessment for today. Thank you for coming in.
Thank you.